Private home sales are often contingent on testing for radon, a clear and odorless gas that's the second leading cause of lung cancer nationwide. If it's detected, the seller must fix the problem. But what about people who depend on safe, well-maintained public housing? I'm Andrew Thien, and this is Beat Check with the Oregonian. Up next, a conversation with investigative reporter Brad Schmidt about his year-long investigation into the invisible problem plaguing our nation's government-funded affordable housing. Schmidt found that many government landlords haven't even bothered to test for radon, potentially putting hundreds of thousands of low-income Americans at risk, and some haven't bothered to make the cheap fixes necessary to ensure those tenants are safe, even when problems are found. That conversation and more is up next. Brad, thanks for taking the time to talk today about your really eye-opening investigation into radon and kind of the lack of action from our federal and local housing authorities. It's really powerful stuff, so thanks for taking the time.
Glad to be here, thanks.
How did you get onto this story?
In April of 2018, I had just finished up a project with Jeff Manning looking at youth basketball and was looking for something new. And I was going through public records, which is what I often do. And I've previously written about the housing authority in Portland. And so I was reviewing essentially their minutes from their meetings. And I came across in their contracting line items some radon mitigation contracting. And at that point, I didn't even know what radon really was. But I thought, well, there might be something here because there's a problem and they're fixing it. Let's look a little closer. The mitigation records showed that Home Forward, the housing authority for Portland and Multnomah County, had found radon. Radon is an odorless, invisible gas that is a known carcinogen. If you're exposed to it over a long enough period of time at high enough levels, it can cause lung cancer. And at that point, I knew it was an issue here and that the housing authority was taking steps to fix it.
So, Brad, we're talking in mid to late November, but last month, Multnomah County's housing authority, Home Forward, presented its tenants with some of the findings from your investigation. Can you talk about that meeting?
Yes. So Home Forward had sort of started doing its radon testing in earnest in 2017. We started last year, and then this year I wanted to see sort of where they were at, and they had done testing in April at 8 complexes. All of those tested high.
How many people live in these complexes?
About 100 units across those 8 complexes tested high. So it was a big deal that they found that much radon in April. And so I checked to see, did tenants get notified about this? And so I just happened to go out to Townhouse Terrace in East Portland on 136 between Division and Powell and started knocking on some doors, essentially to get people's reaction to the radon that was in their homes, assuming that they had been told by Home Forward about the radon that was inside their homes. And again and again and again, I was talking to people who had no idea about the issue. They're like, well, yeah, I remember they came and did some testing. One person actually told me, well, when I didn't hear anything back, I thought that was good news.
Wow.
But actually, that person had high radon in their unit, as did about 24 people at that complex. So I am the one who ends up informing the tenants that they've been living in a unit with high levels of radon. One of those people was a woman named Carol Leavenworth, who'd lived in the same unit for 26 years. She'd raised 2 daughters there, and now she's raising 2 of her grandkids. So all of this prompts an interview with Home Forward. I talked to the executive director. There's some ambiguity in the interview about whether they even knew if they had actually sent out the notice as they were supposed to under their own policy or not, or if they actually were waiting to send out the notice until they could schedule mitigation. But ultimately, they agreed to change their policy and ensure that tenants are notified within 6 weeks.
Okay.
But they hold this meeting on October 1st at Townhouse Terrace. And they basically tell all the tenants, well, here's what your results are. They hand out the sheet that I had obtained through a public records request. And some of the tenants were just, frankly frustrated. One of the people there is like, why are we learning about this from you now when this reporter who doesn't know me at all seems to have more concern about my health than the people who are supposed to. So it was a tense meeting. Home Forward cited the concerns they heard from tenants as the reason that they revised their policy. The concern from tenants, I think, was elevated because they learned about the results from a reporter, not the agency, 6 months after testing occurred.
And the room that they held this meeting in?
The room they held the meeting in also had tested high for radon. Home Forward has a policy where common spaces that test high are supposed to have a warning listed. The agency did not list a warning in that room.
How quickly did you determine that there was more here than just a Multnomah County problem?
HUD, the U.S. Department of Housing and Urban Development, which ultimately pays for and is responsible for the policy setting for local housing authorities all across the country, had said radon is a big deal. In 2013, HUD had issued guidance to every housing authority across the country saying that it strongly encouraged radon testing. Didn't require it, but strongly encouraged it. So at the outset of my reporting, I thought there could be a local story examining why 5 years after HUD said, essentially, do something about this, we were only now doing something. But as part of that, I wanted to learn if Portland maybe was actually ahead of the curve. And so I reached out to 2 housing authorities. One was in Seattle, and Seattle said, no, we're not testing. Seattle, according to state data, is not in an area that is prone to having radon issues. Denver, on the other hand, is in an area that's prone to having radon issues. In fact, state testing data for Denver County showed that about a half of all tests done by private homeowners came back with problems. So when I asked the housing authority if they were conducting radon testing, and the spokeswoman told me no, and in fact, we have no prevalent issues here, I realized that this could be a much bigger story.
It seems pretty easy at face value of why we should care about this. But why should we care about the fact that there are hundreds of thousands of Americans living in these units where we do know, right, that they likely have elevated risk?
We know that about 400,000 people live in public housing units in parts of the country where the anticipated indoor radon level would require mitigation. We don't know if those units all have high levels of radon, but we know that they're in at-risk counties. We should care because these are vulnerable people who do not have the financial resources to move or to test themselves. And they are dependent on taxpayers and taxpayer-funded government programs to help them lead good and fruitful lives. And if a prerequisite of that is living in a home where you and your children could be exposed to a carcinogen, and that's the cost of doing business in this country, then that needs to be explored and explained for everyone to understand that we as a federal government say radon is a serious issue. We as a federal government encourage private homeowners to test to protect themselves. But we as a federal government and we as local government agencies all across the country don't think those rules should apply to our most vulnerable people.
How hard is it to fix if, you have a complex with 40 units and they all have radon?
It's not that hard to fix. It costs some money, but it's not that hard to fix. Testing costs about $60 a unit. Mitigation on average would run about $1,500 to $2,500 a unit, but it can be a lot lower. I have testing records from some of the places that have most recently made fixes, and it's $800-900, so it's not necessarily that expensive. Basically, you put in a mitigation system, which is some pipes and some fans, and it sucks the air with radon away from the foundation of the house, so it's not entering your home and getting trapped there.
Where does radon come from?
So radon is released from the ground from uranium that is in the soil and in the rocks. Uranium breaks down into radium, it breaks down into radon, which breaks down into polonium. I'm not a scientist, and I've gotten way more geeky than I would like to. But basically, there are certain parts of the country that are most at risk based on what's in the ground. And so on the West Coast, Portland is actually sort of one of the big spots.
Yeah.
But mostly it's in the Midwest, the Great Plains, the Northeast.
And I seem to recall, my wife bought the house that we live in. That before you buy a house, is it required to do a radon test, or it depends on it's highly encouraged, right?
Yeah, oftentimes if there is testing that's done, it's done during a real estate transaction. Buyers usually get notices about it, and it's something you can make as a contingent part of your sale, and then oftentimes force the seller to pay for the cost.
And so you mentioned earlier, Brad, that it costs about $60 in some cases, like if someone wants to test their own home or apartment. And how long does it take to test?
Yeah, so the $60 is actually, if you go out and hire a professional, and for the multifamily, you can order a test online for $10-15 and test yourself. We're actually, if you're listening to this, hopefully you're interested in reading the story. We have a video online that shows exactly how you can test. So, you hang a packet, charcoal activated packet in your house for 3 or 4 days, and then you send it to a lab and you get your results back in the mail.
And all for the price of like a 6-pack these days in Oregon.
There you go.
You realize that this could be a much bigger story, but let's take a step back just a little bit. Like, what is a housing authority, and who lives in buildings that are owned or managed by housing authorities like Home Forward here in Multnomah County?
Right. So housing authorities are essentially created back post-World War II when the nation was first starting to address low-income housing needs for people all across the country. Local municipalities or counties will form these independent agencies. They are government entities, and they receive funding from the federal government to subsidize housing for low-income individuals. Public housing is one part of the programs that Housing Authority offers. These are buildings that are actually owned by the local government, and in many cases operated directly by the local government. Okay. There are other programs as well, vouchers, Section 8 vouchers,
right? And you've done reporting on this for a long time, but suffice it to say, you have to fall within a certain income requirement to live in these complexes, right?
Yeah, generally it's going to be 30% median family income or below.
So you started by looking at some of our western-ish cities, I guess, Denver and Seattle, that are a little bigger than us but comparable. Where did you go from there in terms of looking at the radon issue?
So at that point, we wanted to reach out in sort of a national scope and figure out, are housing authorities testing? Are they following this guidance from HUD? Unfortunately, at the time, there was not a uniform set of data HUD wasn't tracking, so we had to basically go out and create our own survey. So I looked at the housing authorities that were the largest in the country based on public housing and essentially worked down the list. And we tried to set criteria to determine, is this an area that is prone to radon? At the time, the CDC did not have its radon data online. They've since put it on. So we actually ended up using a private testing site that listed testing results, and we set a criteria of, okay, are 1 in 5 tests high? If so, then let's reach out to this housing authority that serves people in that county. So I worked down a list and set, if anything more than 900 units, let's try and reach out to them if it hits this criteria on a county by county basis, and started sending emails out. Said, are you testing for radon? If so, how many units have you tested? How many units have come back high? How many have you fixed? And from that, we ended up coming up with a list of 64. And most of them said, no, we aren't doing any testing. If an agency said, yes, we are doing testing, I filed records requests seeking the documentation for the test results.
So, Brad, when you get this data into something where things start to jump out to you as a reporter, what was jumping out to you?
The sheer number of housing authorities that weren't doing testing. And then the housing authorities that did do testing often were finding radon. Even in limited sampling, we were seeing that if they look, they tend to find radon in at least one unit.
You mentioned earlier that radon is a carcinogen, a known carcinogen. How does anyone know if they have radon in their home or apartment if they live there?
Well, that's just the issue. Since it's invisible, you don't know it's there. You can't smell it. You can't see it. You can't taste it. So the only way to find out is to test. And, the federal government for 30 plus years has been encouraging homeowners to test. But the federal government has not ensured that people who live in low-income housing are having their units tested. And so since the only way was to test to find out, we thought, well, how about these places that aren't doing testing? Wonder what would happen if we decided to test.
This is kind of one of the things that really makes your investigation stand out. This is not something we do a lot of in terms of mailing testing supplies around the country. Can you tell listeners what exactly you had to do to make this experiment come to life, I guess?
As I was looking at the list of housing authorities that hadn't done testing or hadn't done much testing or hadn't done testing in a long time, it just so turned out that some of them were in markets that were also part of our parent company, Advanced Local. We came up with this idea of what if we involve some of our partners and go out and distribute test kits at public housing locations and see what we find. If we test, will we find radon? So we partnered with news organizations in Cleveland, Ohio, Syracuse, New York, Harrisburg, Pennsylvania, our news partner in Massachusetts, and in Huntsville, Alabama. And I actually went to Denver and distributed test kits myself to tenants. In some cases, I set up the test myself, and then I called them and said, hey, it's time to take the test down and walk them through it. And in other instances, I actually left test kits with the individuals and then walk them through setup and takedown of these tests by phone. It was a lot of hand holding, and I have to say I'm really grateful to the tenants there in Denver who were willing to participate, because it was a bit of a time-consuming process.
A time-consuming process that you're also, asking to come into their home in some cases and physically test for something that, I'm sure a lot of folks hadn't heard of, right?
Yeah, absolutely. I actually had a spiel that I worked on prior to, and I could recite it in about a minute. And then I gave it to the colleagues across the country who would be doing this. It's sort of a big ask. Like, hey, I'm this random guy from Oregon, by the way, not Denver, Oregon. And I'm here to test for an invisible gas that you've never heard of, that if you're exposed to it for a long enough period of time at a high enough level, it could give you lung cancer. Just because you're exposed to it doesn't mean you're necessarily going to get lung cancer, but it's a risk. And would you like to find out if you have it in your unit? And if so, can I please come in and help you set up this test? Yeah, it was interesting. It was fun. And, to people's credit, a lot of people were like, yes, yeah, come on in. Like, yeah, let's find out.
Did you have doors slammed in your face as well?
Slammed in my face, no. Some people were skeptical. They wanted to see credentials. Yeah. And, you're having some random stranger walk into your house who 5 seconds before you'd never even heard of. So, yeah.
Yeah, that's fair. I mean, if someone comes to my door, I would want to see the receipts, so to speak. So what exactly did when these results started rolling in, what were the findings?
I found high results initially in 5 units in Denver. And we had been talking with radon professionals all along to make sure we were doing it right. And so we knew even if we found it one time with these short-term test kits, we would want to go back and test a second time and then take the average of the two, because that's the standard that's used. So I got 5 tests that were back from 5 units. And then contacted those tenants and went through the whole process again, and 3 of them were high a second time. So at that point, I mean, clearly I knew, okay, we've got a story here. And in conjunction with this timing, folks across the country were also doing the testing. And we ended up finding high test results in Huntsville, Alabama, and Worcester, Massachusetts. In the other locations where we didn't find high test results, that's not dispositive that there isn't something there. We did a very limited sample. We did not test every unit. And, in some cases it's a challenge. In one of the locations in Harrisburg, the reporters were pretty upfront when they got back. They're like, listen, the tenants who live here say they have heating issues and the heat's always on. And so their units get hot. And so a lot of them were like, well, we'll test, but we're going to leave the window open a crack because that's how we cool our unit because it's too hot. And radon, you test for it in closed conditions, meaning the windows are closed. So when we didn't get any high test results back in Harrisburg, again, it does it mean that there's no radon there, or does it mean that our testing conditions weren't ideal because the tenants wanted to not close their windows, which is completely fair. I mean, if you don't want to be in a sweltering apartment, it is what it is. So that is just but one example of some of the challenges that we encountered as reporters. But it's very hard to get a false positive. It's very easy to get a false negative. So we stand by our testing.
Let's take a break. So Brad, as an investigative reporter, you often have pretty significant roadblocks from the agencies that you're covering. We talked a little bit about gathering the data from around the country, but what other barriers did you face in your reporting from some of the housing authorities or the federal government as you proceeded on this?
The hurdles were immeasurable. From the very get-go, when we started reaching out to housing authorities, thought, well, let's just simply ask, have you tested for radon? And in many cases, it didn't prompt a response. So, okay, let's follow up again. Let's follow up again. Let's follow up again. 4 times we're asking nicely, hey, have you done this? And so we started to actually have to file records requests for agencies that hadn't responded just to force their hand. So that's number 1. Then number 2, when we went out and did the testing, and after we got the testing results back, we provided them with the housing authorities that we were going to say, we went out and tested, found radon, and we'd like to talk with you about it. In 2 cases, the housing authorities just didn't respond for a week and a half, started having to call board members before I started getting responses back. Like, okay, we'll agree to an interview. In one case, a housing authority that I'd previously spoken with that had said it had done testing, which we went out and did the testing. After I told them, hey, we went and did testing and here's what we found, love to talk with you about it. Not only did I not hear anything back, what I believe was an errantly sent email from one of the employees said something to the effect of, this guy's calling me, I'm not responding either. So clearly I knew that people didn't want to talk about this issue. And then, HUD was a challenge in and of itself. We presented some preliminary findings to the agency back in August and waited around for about 6 weeks to see if Secretary Carson would talk with us, and ultimately was told that he wouldn't.
This is Secretary Ben Carson, the famed neurosurgeon who's the head of the agency.
Yes, yes. And just going back to HUD as well, we actually started talking with them last year, about 2-3 months into this, when I realized, okay, this is national in scope. And prior to the 2013 Strongly Encourage issue, way back in 1988, there was actually a law on the books that put HUD on notice to make sure that people who lived in public housing weren't being exposed to radon. And so I started doing that deep historical dive to make sure I understood. And so we had posed some questions and just, hey, this is what I'm seeing. Am I missing anything here? And so, HUD was somewhat responsive, but not particularly eager, shall we say.
And it's often in these types of investigations, especially with this scale, It's not unusual to see real-time impacts, whether it's a policy enacted or someone losing their job or something happens along the way as you're reporting. That happened here as well. Can you describe kind of what happened in the last year as you were reporting on this issue?
Yeah, so at the 3 locations where we did testing and presented the information to the housing authorities that we had found radon.
That's in Denver,
Huntsville, and Worcester.
Okay.
We said, here's what we found. What do you think? Are you going to do anything? Essentially. None of them decided to test. Separately, however, we found in some instances that housing authorities had actually done some of their own testing. And so we followed up to see what had happened with that. And so in 3 cities, we found housing authorities had done testing, found high results, and did not fix those units. Let people live in units where there was known elevated levels of radon. One of those was in Pittsburgh. After our inquiry, Pittsburgh said, essentially, yep, we should have fixed that. Sorry about that. We're going to fix it. And so they fixed 4 units where elevated radon had been found.
4?
4. In Portland, Maine, the housing authority had actually tested back in 2014 to meet the requirements of a state law. They had found high radon in 48 units. They said, well, that's not definitive. Let's go do long-term testing. And then they confirmed high levels in about half of those. So when I roll around in 2018 asking questions about this, and they say, well, we didn't fix those units. It's not required. Mm-hmm. I said, okay, well, I understand it's not required, but you found high radon twice in more than 24 units. Do you think the tenants should be breathing that? Why aren't you fixing it? And so after my inquiry, the agency decided that, yes, indeed, it would fix units. And so it launched mitigation efforts. Instead of fixing every unit, however, they decided they wanted to do a 3rd round of testing, went back to short-term tests, and then only tested the units that were high that 3rd time. And then finally, in Omaha, Nebraska, that was an agency that was not testing back in 2018. I talked to a former executive director there who said, well, it's on our to-do list. And to their credit, they actually did do it after our inquiry. It was something that was on their to-do list.
Okay.
So they did it. They tested, and they started finding high test results in single-family homes that the housing authority owned. Through May, they found high test results in 16 of 38 homes that were tested. But they hadn't taken steps to fix all but one of them. So when we started asking why that had happened, the new executive director started asking some critical questions of her staff about what went wrong, essentially. Long story short, the guy who was in charge of the public housing department no longer works there. The executive director told us that he told her that he didn't receive test results back until July 31st of this year. I filed a records request that showed that he started receiving test results from another staff member there back in December and actually received the test results directly from the contractor in May. So
they knew.
They knew, and they didn't do anything except in one case.
Can you tell folks a little bit about Thomas Faison? He's another Portlander who you talked to and has a pretty disturbing story.
One of the folks I was talking with said, hey, I know this guy who has lung cancer, and his doctor believes that it was linked to radon exposure. I ended up connecting with Thomas, and we were talking about his story, and he told me some of the places that he had lived as his child, and I researched the ownership of those houses, and lo and behold, the place where he spent his elementary school years was owned by the Housing Authority of Portland, and the agency confirmed that it was, in fact, public housing. It was one of those single-family homes that the agency owned. There's no way to know what the radon levels were in the home when he lived there. It was 30 years ago, at the exact same time that HUD was being told by Congress to do something about radon. But we know that the home next door to his has a radon mitigation system installed, and we know that he went to an elementary school that had high levels of radon, and we know that he went to a middle school that had high levels of radon. We know that his doctor believes that it was his lung cancer was caused by radon, or that she strongly suspects that it was. There's no way to know for sure.
And how old is Thomas?
So Thomas was 35 years old when he was diagnosed with lung cancer. He's a father of 4. He grew up in Portland. He went to Grant High School. He was on the wrestling team and he ran track. He's moved around the country for a variety of jobs, ultimately ended up working the production line at Nabisco here locally. He's about our age, and he's dealing with this life-altering event. He has late-stage lung cancer. He's tried prescription pills. He's tried chemo. He's tried what is now a trial. And, as I've talked to him over numerous sit-downs, he's stressed, For people who question, is radon a serious issue, I would point to Thomas. There's no way to know for sure that radon caused his lung cancer, but his doctor believes it did. And he's living with something that I don't think anyone else would want to be dealing with.
You've reported on affordable housing issues dating back almost a decade now, right here in Portland. And now this issue has kind of brought this nationally for you and kind of exposed this issue that a lot of people have no idea about, haven't heard about. I mean, what's your big takeaway from your reporting on this issue?
Well, I think it raises some interesting questions about how we pay for housing in this country. Obviously, we have this affordable housing crisis in Portland, and this is an agency, Home Forward, that provides more affordable housing than anyone else in the region. So first and foremost, they should be recognized for the job that they do and for the fact that they are putting vulnerable people in homes and helping those people. That said, public housing gets its money from Congress, and how are we funding this program that helps keep the roofs over the heads of so many needy families? And, again and again and again, what I heard from housing authorities is, we'd love to test, we'd love to, ensure every possible risk under the sun is taken care of. But given our limited budgets, what can we do? Mm-hmm. And so, I think that if nothing else, this story will spark, hopefully, a conversation about what is the adequate level of funding that's needed to ensure the health and safety of the people who live in this housing. And should that include radon testing as more than a strong encouragement to help keep people safe?
Well, Brad, thank you so much for your work and for taking the time to talk about it.
Thank you.
Before we end the show, a quick conversation with editor Amy Wong about Season of Sharing, the Oregonian's annual holiday fundraising campaign.
So Season of Sharing actually started in 1931 at the Oregon Journal newspaper, a former Portland daily. It was the Great Depression, of course, and so the newspaper began organizing Christmas parties for those in need. Somebody would dress up as Santa Claus and pass out stockings filled with treats at community clubs and social agencies and churches. After the Journal and Oregonian merged in 1982, the Oregonian took over the campaign and named it Season of Sharing. Today, it is our holiday fundraising campaign to help social service agencies in Oregon and Southwest Washington that help individuals and families in need in our area.
What can you tell us about the crop of agencies we're working with this year?
So we are helping 8 agencies that work in the areas of the arts, addiction and recovery, disability, and homelessness.
And what kind of services do these agencies, you gave the umbrella of the various causes, but what kind of services do they provide, and is it all around the metro area?
We have 7 agencies that are in the Portland metro area and 1 down in Southern Oregon in Roseburg. And we looked for a range of services. One example is Oregon Children's Theater, which you might not think of normally as a social services agency. But they have a program called Ticket to Read, which works specifically with children at low-income schools who may have very little experience with theater and literature. And so it kind of opens the door to that world for those kids. One of our other well-known agencies is Ride Connection, which provides transportation for people who don't have access to it, either because of disability or because of other reasons. Our Roseburg agency is Safe Haven Maternity Home, which basically provides a refuge and a second chance for pregnant women or new moms who are in crisis.
How can folks give? What are the methods?
There are two ways. You can write out a check to Oregonian Season of Sharing and mail it to our credit union. You can find the address for that at oregonlive.com/sharing. We have partnered this year with GoFundMe. And so if you go to GoFundMe's website and search for Season of Sharing, you will find our campaign page where you can either donate to the general Season of Sharing fund or to a specific agency.
And you can do that on your smartphone too.
That's right.
Well, what else should Oregonians know about why we do this or how they can help? I mean, obviously around Thanksgiving, we all kind of, in the holiday season, we all kind of look internally about how we can help. But I mean, what else should folks know?
Well, I think Season of Sharing really epitomizes our work in journalism as a community service. There's that old saying that I'm sure you know, that we're here to afflict the comfortable and comfort the afflicted. Even though afflicted is a term that's sort of fallen out of favor, I think the idea behind it is still very valid. I know some folks on staff who feel like this is some of the most important work they do all year.
What kind of feedback do we get from the agencies that we work with?
The agencies find that it always raises their profile. They do see more donations. One thing that I didn't expect when I first started working with Season of Sharing, they see a lot more people coming forward to volunteer with agencies. Just today, we got an email, one of the reporters who worked on Season of Sharing this year, from a father whose son has been helped by one of the agencies that we profiled. And he told us, he couldn't appreciate more what the agency does, and it really warmed his heart to see it getting some recognition publicly.
Amy, what else should our readers know about Season of Sharing and why we do this?
Well, Season of Sharing is administered by a nonprofit, which is called Oregonian Public Benefits. And so the Oregonian covers just about all administrative fees for the campaign. We don't make any money off it. Also, for people who are concerned about GoFundMe charging fees, for this particular campaign, GoFundMe is not charging any fees. The only fees are credit card processing fees, which donors can actually cover by choosing a tipping option.
Oh, wow. So it really removes all those barriers and questions about where the money goes. Well, thanks so much for running this for us and for taking the time to describe the program.
Thanks for the opportunity.
You can read profiles about the 8 agencies we're working with this year on oregonlive.com/sharing. Thanks for listening to Beat Check with the Oregonian. Check out Brad's investigative story, video, and database about radon at oregonlive.com/radon. Check out my stories on the transportation beat at oregonlive.com/commuting or follow me on Twitter at @AndrewTheen. You can subscribe to Beat Check anywhere you get your podcasts to hear the latest episodes. If you like the show, please leave us a rating and review to help us spread the word. Until next time.